Mental health disorders were the leading healthcare expenditure in the United States in 2013 at around $201 billion. Since then, the incidence of mental health illness has only increased, with 2019 statistics showing that about 19.86%, or about 50 million of the U.S. adult population, has experienced mental illness. Despite these statistics, only about 24.7% of adults with mental illness still do not receive treatment. In addition, the national rate of suicide ideation among American adults has increased every year since 2011. In 2021, 4.58% of American adults reported having serious thoughts of suicide, an increase of over 664,000 people from 2020. Experts now agree that addressing mental health must be an integral part of the COVID-19 response and requires a multifaceted collaborative approach. There are about 6 main challenges in addressing mental health: knowledge gaps, stigma, access to care, workforce shortages, quality of care and variation in practice, and fiscal performance and payment landscape. To address these issues, my mental health experts team and approach to the problem would include partnering with leading mental health and well-being research institutes like the Stanford Medical, Mayo Clinic, the American Medical Association, and the National Alliance on Mental Health, or NAMI, to establish best practices for healthy mental health and mental health care, as well as to establish standard of quality of education for training for mental health medical practice. Partnering with educators is also a strong tactic, including primary, secondary, and collegiate levels, in order to increase awareness of the issue and reduce stigma of mental illness, as well as to increase access of care from a young age and into adulthood. Increased exposure to mental health from an early age will also increase attrition to mental health careers later in life. I would also partner with healthcare professionals, including physicians, allied health professionals, residents, nurses, and so on, to ensure they are also practicing and preaching healthy mental health. We would also work to lobby Senate and House representatives to work towards policy changes regarding fiscal performance and payment landscape in healthcare. We would also use those representatives to help to create policy deploying mental health professionals to appropriate emergency calls along with emergency personnel. Further, we would partner with hospitals and healthcare systems to offer tuition reimbursement or tuition waivers to individuals wishing to pursue careers in the mental health field in order to increase the number of individuals available to treat those with mental health needs. And finally, we would amplify the groundwork already established by community organizations like the National Alliance on Mental Health to expand mental health first aid and psychological first aid to give individuals standardized training for recognizing mental health distress and providing in-the-moment aid for those in need of mental health resources and support.